Hi guys, thank you all for showing up for this presentation. I would like to introduce Claudia Guinansaca-Aguilar. She graduated in 2014. She's a second-year veterinary student at Cornell University in Ithaca, and she will be presenting first. And then we also have Annie Scorcia, who also graduated in 2014. And she is a certified dietitian nutritionist, and she's working currently in a nursing home in Scarsdale. So I'm going to give the floor to them.
As mentioned, I'm Claudia. I am a second-year vet student at Cornell. I can talk about a career in veterinary medicine, even though I'm still kind of figuring that out myself. But for those that are not really familiar, the requirements to be a veterinarian are kind of similar to being a human medicine doctor. You have to do 4 years of undergrad, and then you do apply to vet school and get in 4 years of vet school. The main difference is you don't have to do an internship or a residency after you graduate. If you want to do your, if you want to just be your general practice family vet that some of you might take your pets to, you can do that after 4 years, which is really nice. But kind of about my journey, I think I decided I wanted to be a vet very early on in like middle school. I've just always been working towards that. Loved math and science, loved learning, did science research in high school, loved that. Did well. I made a lot of things. And then graduated, went to Cornell where I majored for undergrad too. I majored in animal science. And then took a gap year after I graduated, came home, worked full-time as a vet assistant in Pleasantville at a small animal practice. Applied for vet school then, got into only one school, got rejected from 3 of them, but got very lucky. And then now I'm here again in Ithaca at Cornell. I'm interested mainly in emergency medicine, small animal emergency medicine. And then maybe 10 years down the line, once I've paid off all of my loans, probably open my own practice. So own my own business is the goal. I brought pictures of a lot of animals because it's probably more interesting to look at than just me talking. Okay, cool. Yeah, so this is kind of a little bit what vet school looks like. It's a lot of animals. This is some fun things I did in undergrad. I got to rectally palpate a cow, got to dissect chickens a couple of times. Like I said, I used this really long clip of my cats at a clinic, hopefully if this video plays. But I did gap year. Mostly because I didn't, I don't think this is gonna play, so I'll just skip it. Because application wasn't strong enough to get into vet school. My GPA wasn't great, in all honesty, wasn't super competitive. The transition to college was really difficult for me, and I had a really hard time finding veterinary experience, which is a really crucial component of your application. So I needed to take that year to actually get clinical work. Which I did, and it was really great, and it was really fun, and I learned a lot. I also worked there sometimes over the summer, so this was during COVID. Another fun thing that I did, I hope this video plays, like I said, veterinary experience is really crucial to your application, and they just don't want you to work with cats and dogs. They want you to see the good, the bad, and the ugly of veterinary medicine, so you kind of know what you're getting yourself into. So I did this one thing. I don't think that's going to play, but oh, sorry, some of these might be a little graphic, but I went to New Hampshire for 3 weeks, and I worked at a equine specialty center. I don't know anything about horses. I'm not interested in equine medicine, but I wanted to do something that was out of my comfort zone, and I thought it would also look really good on my applications to, kind of have this varied experience. That's just a horse and surgery. And then I don't think the videos will play, but at least you'll get to see just the short image. They're doing a dental on a horse there. But besides that, that was my gap year, and now I'm in vet school, and this is us practicing our physical exams on cats and stuff. We do that straight in the first year, but a lot of my life is studying and being in lecture. All the lectures are sometimes fun when they bring in alpacas and llamas, but that's very rare, but still a highlight. I think that's a short clip. This is what my life looks like now. Zoom lectures and sitting at my desk and writing up notes, although sometimes my cat likes to join in on the fun. Outside of just studying, though, I promise I do more fun things. students run a clinic downtown in Ithaca. We run the whole thing and serve the community. We also do, oh, this one might be graphic, but I hope it won't play. We get to do these fun labs where they teach us clinical skills. So in this one, if it's not choppy, they taught us how to remove an eye, how to do an eye enucleation, which is really great that they get us started practicing our clinical skills really early on in the curriculum. I don't think it'll play. That's okay. I'll just let it go. This is for my only clinical lab this semester, hence all the PPE. I got to do an epidural on a cow and check for babies. The cow was not pregnant, unfortunately, but more cows. Again, these videos are not going to play, which is sad. But I work 2 jobs on campus because vet school is expensive, and one of them is working with cows. I'm a student milker. We have about 150 dairy cows in our teaching dairy barn. This video is like me getting all the cows into their gates before we attach these milking units on them. I have no experience in cows. I'm not interested in bovine medicine. Again, it was something they really emphasize in vet school, that you just kind of keep your mind open. You just do whatever comes your way. So I figured, why not learn about some cows? And they're great. They're just like big dogs. These are puppies from a C-section that I went to go help at 2 a.m. About a month ago. And then they're so cute. They're bulldog puppies. Then this is my last job. I work as an imaging technician at the teaching hospital. These are where we do all the x-rays. They call me, I sit at this desk and I do work until they call me and tell me that someone needs rads. And this is a cat radiograph that I took, a cat that wasn't pooping. So you can see there's a lot of gas in those intestines. But yeah.
Claudia, do you have debt from all of your years at Cornell?
I know you love talking about money. Okay, so I have debt currently. I got really lucky in undergrad. I don't have any undergrad debt. A lot of my classmates do. But I worked really hard to get into a college that I knew would financially support me through undergrad, because I knew I was going to accumulate that in grad school. So I have debt from vet school, which is a struggle.
Quickly before we get into the chat, Claudia, could you explain what a gap year is and how you got your positions during the gap year?
Yeah. So essentially, the timeline to get into vet school is very similar to like high schoolers going to college. You apply in your senior year, and then you get in the spring, and then you go straight after graduation. If you don't do that after you graduate, you kind of just have that year off. And so I applied to vet school after I graduated. So like the September after I graduated, got in the spring, and then went to vet school after that. As to how I got my job, it was really hard for me to find veterinary experience. But honestly, it was all networking. I started reaching out to anyone and everyone I knew, asking, do you know someone who's hiring? I have the year to invest, and I can like work now. So I started off as an intern, just kind of shadowing. I started small. The key to asking sometimes these veterinarians is just start small. Like, I can, clean cages. I can do laundry for you. They liked me enough. They knew I was a hard worker, and they knew I was interested in veterinary medicine. Eventually, they offered me a job because they just needed the help.
Okay, thank you. From Mr. Mayer, what was one of the scariest experiences with the animals that you worked with?
Scariest? Yeah. So there was this dog. Okay, this might get a little graphic, but when I worked at the clinic, we had, I think the scariest are always the emergency experiences, because this woman came in with her dog, and the garage door had fell on her small, like, Shih Tzu puppy. Not puppy, it was just a small Shih Tzu. And that was really scary. That dog was completely unresponsive, and it's like a tear. I want to do emergency medicine, which is kind of funny, but it's you have to kind of gather, like, you have to stay focused, because you have a emotional owner, but you also have a pet that's in a critical state that you need to turn your attention to, and you just kind of have to get the information that you need to get and go. So that was kind of the scariest experience, in that like I needed to I was the one who like gathered the pet, and I, as an assistant, I didn't have much I could say other than, I will take this to the vet immediately. Please wait here. I'm going to run to the back. Unfortunately, that pet did not survive, but yeah.
Is it difficult to separate your personal feelings from the job that you have to do? Like, what is that like, dealing with that?
Yeah, veterinary medicine definitely is an emotional toll at sometimes. I find it, in the moment, I get hyper focused. I say that there's a job that needs to be done. I'm very goal oriented to begin with. So if there's something that I need to do, emotions are very easy for me to block out. It depends from person to person, I know, but that's how I'm able to. I just give myself goals and I focus on what's in front of me. And then later at the end, maybe I can move on. I feel it later. It comes to me later.
Okay, all right. From Ms. Holmes, how different do you think the vet school experience is from the med school experience?
I don't think it's that different. We're learning about more species, number one. And number two, it's not as much, you learn a lot. You learn a little about a lot, I guess. Whereas in human medicine, you learn a lot about a little. And it's a little different in terms of service, because your patients can't tell you what's wrong with them, and you kind of have to pick and choose and put the puzzle together from an owner.
Okay, all right. Thank you, Claudia, so much.
Yeah.
If you look in the chat, there are quite a few questions from Mr. Mayor. Scott,
I will answer.
Thank you so much. Now, Annie, if you could start your presentation, that would be wonderful.
Yeah. All right, is that working?
Yes.
And everyone you can hear me?
Yes.
All right. So, okay. So, nutrition and dietetics. The first picture is me from 2013, 2012, go OVGS. And the second one is from me a couple months ago when I got my COVID shot. I do work in a nursing home. So yeah, we were A1 for receiving the vaccine. Quick slide, what my patients think I do. People think that I'm the food police. People think my job is to step in and say no to everything. And everyone thinks I'm that person who just like posts on Instagram about fad diets and laughs at salads. When it comes to explaining what I actually do, it doesn't really fit in one picture, unfortunately. So what I actually do, I work with our medical team. I visit a patient when they first come in. I evaluate them based on the diagnoses they've received, and then I make my own diagnosis. I then intervene based on what they need. I monitor based on my interventions, and then I evaluate periodically to see if those are working. And what that looks like is if I have somebody who comes in, for instance, who has diabetes, I create a medically appropriate diet to make sure that their blood sugars aren't spiking. And then I often do also education for patients so that when they go home, they're also eating well at home. Unfortunately, a lot of what I do right now is people come in and there's a lot going on in their life. In COVID, a lot of them haven't seen their families for over a year because the nursing homes are shut down. And I walk in and I ask them, how's your appetite? And we get some good conversation, but it's definitely not the ideal situation right now. Day to day, I come in, I get a shift summary from nursing because we don't have a dietitian overnight. So I see, any updates they have on patients. I create my list of people to go see for the day, who to evaluate. I always look at people who are losing weight. We don't want people losing weight in the nursing home. So that's one of the biggest things we focus on. At 10 a.m., I have a clinical meeting. I discuss people I have concerns about. At 11 o'clock, I go see people who I have concerns about, do my own evaluation, not just based on other people's notes. And then from 1 till when I leave about 4, it's a lot of charting. So going through our medical chart and just writing my own notes based on other observations and my own observations and making interventions to help the residents here. What I don't do for any dietitian, no matter what type of role you go into, we don't shame people for what they eat. We don't tell people they can't have dessert. I do not sell pills. I do not sell supplements. We're not here. If you ever see an ad for like, you can lose, 30 pounds in 1 week, we do not do that. That is not safe. And I don't sell fad diets, which just refers to diets that help you lose weight really fast with some sort of magical component. You take this special vitamin, you're going to lose weight like that. We don't do anything like that. What goes into this? If you look at the BS-MS part, a bachelor's degree in nutritional science, a master's degree, usually it'll be in nutritional science, mine's in health services. The RD-CDN part, that's internship hours. The internships are competitive to get into, but if you get in, you do 1,000 hours, you pass your exam, and then you can get approved by New York State by showing them that you've passed your exam. And what this means for me is that I get to be a healthcare worker who does not have to deal with blood. Sorry, Claudia, your pictures freaked me out. I'm glad you do it. I did mute it once I heard garage door. But yeah, and then I get to be part of a medical team and evaluate and work with all the other disciplines here, but I don't do blood. And then what this can look like for you. There are lots of different fields that you can go into as a dietitian. And that's really cool because it means you can really change your career without having to go back to school. These jobs are ranked right now by pay. So clinical dietitian, which is what I do, that's usually around $60,000 starting. Sports dietitian, you can work for like a local team. You can work with local athletes one-on-one, or you can go work for the New York Giants. Doing that. Counselors, nutrition counselors, you can charge about $300 an hour to help people lose weight or help people gain weight, or talk about disordered eating. Public health dietitian, if you work for the Department of Agriculture, that's about $100,000 a year, depending on what branch you're in. The WIC food bank, that's actually going to rank lower than clinical, so that's going to be more around $40,000 a year. Food service is also around $100,000 plus. That's a pretty steady job. That's a lot of food planning, menu planning, and then food scientist. You can go work for Coca-Cola, and I don't even know what kind of money you make from that, but a lot. But yeah, that's my presentation. If we want to do questions.
I have one quick question, Annie.
Yeah.
If I remember correctly, you were in a BS-MS program, like a 5-year program?
So I did 3 years for my undergrad, and then it was about a year for my master's, and then your internship is the other half of the credits for your master's. And for anybody who's watching this video who isn't, I don't know if you guys are seniors, take as many SUNY AP classes as you can. I went into my freshman year with 27 credits. That saved me an entire freshman year. I went to school for 3 years because of OHS. Do that. $200 class is so much less expensive than a $2,000 class, which is the cheapest class you're going to find. If you go to if you don't go to a community college, I don't really know what the pricing is there.
Which ties in with my next question. How well did OHS prepare you for your college education?
College is different than high school. You're never going to get an assignment where someone gives you a worksheet and says, turn this in the next day. And that's good in some ways. I liked being able to get an assignment and knowing, or getting a syllabus and knowing like I had an assignment due in 3 weeks, but I'm busy that third week, so I'm going to do it the week before. If you're not good at planning, there's a harder transition getting into college because you have to plan all of that out yourself. What OHS taught me, because I just had some really incredible teachers, isn't necessarily one specific class, but was definitely about when you're talking to patients, they do not care what you have to say until they know how much you care. Learning how to speak to people is so important, in classes like SUNY race, like your English classes, like those are just as important as your science classes. You need to know how to talk to people.
how long do you stay with a patient? Like, do you just go in for a week, or do you work with that patient for a month? Or
Right. So that depends on what setting you're in. I'm in the nursing home, so people here are generally long-term. So there are some people who I go in, I check, I say, hey, do you want to let me know anything that's going on? They say no, that's like a 1-minute conversation. There are people where, I go in the room every single day and I say, like, they're not eating well, and I watch them eat. But very rarely do you work with someone every single day. Nutrition is more about, it's less clinical than the doctor, where like, I'm looking for changes over a longer period of time. So I'm not seeing someone every single day.
Okay. So we've all been watching the news for the past year, and we know we have so much information about nursing homes. How much has COVID affected your career and your experience in the nursing home?
Yeah, I think Claudia can probably attest to this too. You definitely have a distance from people because it requires you being completely gowned up. I talk to people who can't hear, and I'm wearing 2 masks, a face shield, a gown, a hairnet, gloves, and booties over my shoes. It's not, they can't tell the difference between me and another profession. It's definitely different. Just the relationships that you have with people and the relationships they have with their loved ones are definitely on hold right now because they can't get in here. So it's definitely different. The way that I do my job in particular, though, hasn't changed. It's still a highly hygienic environment. You're still, again, Claudia will know, like, you're constantly washing your hands. You're constantly following proper hygiene. I'm doing the same job, but it's very different for the life of my patients.
Okay. Claudia, same question, different field, but same question.
Yeah. When I worked at summer small animal practice, it was definitely different. We did carside service, and so it was helpful in some ways, but also really detrimental to owners in another, because as an owner, I understand their side. They want to be in there with their pet, and it gives them a sense of calm to like know what's going on. I mean, kind of anxiety must you have handing off your pet to strangers. But it really challenged us to communicate and like ensure that we're going to do everything possible to get what you want out of the service today. But there were definitely some issues that arose sometimes from owners that wanted things a certain way and us not being able to provide that.
Okay. Thank you. From Mr. Yonkler, is it true that animals can't get COVID?
Oh, yeah, I was writing up like this specific strain of COVID, SARS-CoV-2. There are some weird documented cases. I think there was a cat and a dog that got it, but I don't think that's super common. Cats themselves have a specific strain of coronavirus that causes feline infectious peritonitis. So they already have, but that's a GI disease. So they have their own strain to worry about.
Okay. And from Mr. Jaffes, Annie, what are other options that you thought about besides being a dietitian?
I actually got my letter in the one you guys write yourself in health class. I got that a couple years ago, and I'm 15, and it was like, I want to be a nutritionist, and I was like, good job, baby Annie. So I definitely thought I was going to be a dietitian for a long time. But in terms of what I would be otherwise, I think that within my career, there's a lot to change. So I'm in clinical right now. I would like to eventually transition to more working with people one-on-one. But yeah, no, this is always what I wanted to do.
Okay. And Claudia, did you consider med school to work on humans, or was it always vet medicine?
No, never humans. I was afraid of humans because I was like, I like animals. Humans are nasty. But that's a thought to have. But I learned in my gap year working as the vet assistant that it is also a people-oriented job. Like you're talking, like the pets are attached to humans, so it's not just animals. You have to interact with people.
Yeah, they're pretty funny actually. What do you wish that you had learned or learned more of or learned differently during high school?
Is that for me, for Claudia?
Oh, okay. Claudia will go first, and then you'll go second.
Oh, yeah, sure. I sort of alluded to it in one of the questions that Dr. Mayer's class and it was just networking and like how to talk to people. Because I mean, like, I'm just slowly learning right now. Like, my entire summer is built up in externships right now because I reached out to people that I didn't even think possible. And that's not something I really did in high school or knew I could even do. Like, first gen, like, my parents are immigrants. And so I really had no idea what I was doing most of the time. And I didn't have that built in network that comes with your parents knowing other people. So,
Annie?
What I wish I had known. I mean, I definitely think, again, like, take all those SUNY especially the SUNY classes. Some of them are worth double the credits. But I studied mostly English and social studies when I was in high school. I shied away from a lot of the math and science classes, which is mostly what I do now. Learn how to work hard. You don't have to pick what you want to do for the rest of your life when you're 18. Like, it's okay if you don't know. There is time to figure it out. You can change your mind. Just learn how to work hard and find the way that's best to study for you.
Can I interject, Ms. Amato, just real fast? I've heard that so many times, right? From all the alumni. You don't have to figure it out right away. And a winding path can be a great path, right? So I mean, little Annie knew at 15, but not everybody does know, right? And that's okay. Thank you, guys. So awesome. Thank you, Ms. Amato.
So for Annie, you mentioned that you did mostly English and social studies courses. How hard was it to make the transition from English social studies to math science?
It actually, it wasn't particularly hard. I think that college was just a setup that worked better for the way that I think I was really busy in high school. I think by my senior year, I was like either really involved or president of like 5 clubs and doing soccer and doing drama club. I took a class independent study my senior year with you, Miss Amato. So I took like 10 out of 9 classes a day my senior year. I didn't do it that time. That wasn't me. I think that I learned how to study, and you'll have to play with that. But I think I knew how to work hard, and I think I learned how to study that first year. I don't think the transition. I'm probably just not the best person to ask that question. I'm sure there's a transition, but
Claudia, your courses during your high school years, what were they made up of mostly? Were you mostly math science or? I
was mostly math science. Yeah, I packed my schedule pretty hard. I did all the AP bio, SUNY chem thing. I didn't take any physics because physics scared me, and then I had to do it in undergrad, and it was not that fun. But yeah, a lot of these provided a great foundation. You don't have to major in like animal science to go to vet school. You just have to get the prereqs done in order before you apply. So I knew that that's what was coming for me, so I had to set myself up for a good foundation for those courses that I would have to take in college.
Okay. So I'm gonna put a plug for writing here. Do you guys, either one of you, do a lot of writing in your career? In your field?
Yes, charting is.
What was your English teacher, Miss Amato?
I can't help myself.
I have to make educational handouts, and I write every single day for charting. Yeah, you will never stop needing the stuff that you learn in English, and it's very apparent with people who are trying to explain things in the medical field. If you did not learn how to write a critical lens essay, we noticed. We noticed. Please go back and learn how to compare and contrast.
There you go.
Claudia.
The importance of writing is obviously very obvious. I don't do a lot of writing personally, but I probably will once I start doing case write-ups. I also am not super involved in research, although I might be next year. So I'm sure if I have to start writing research papers and grants and stuff, that will have to come into play at some point.
Okay. What surprised you most about life after OHS?
That it got easier in a lot of ways. There's, growing up, there's a lot more freedom that you can have, and that can be scary if you don't know how to balance out your time, or if you need a little help learning how to balance out your time. But the freedom is really nice to make your own decisions, to like fail or succeed on your own. The freedom, that's the biggest thing for me, and learning how to ask for help in that freedom, because you're not going to know what to do. You need to learn to ask for help.
And Claudia, will ask you first. What is the one skill that you think is most important for your current or future success in your career?
Communicating to people and for what I need. Like especially as a veterinarian, and now as I'm trying to, figure out my way in my career path, communicating to other people what I need.
Okay. Annie? Thank you, Claudia.
Yeah, I'd say the exact same thing. You can know everything. If you can't find a way to get that information to other people, you're not good at your job. You need to know how to communicate.
So, advice. There's the writing, there's a communication piece. What other advice would you give to the students who are watching right now?
Breathe. The things that you do right now, so many of them are only going to matter up until that college application. I was the president of like the chess club. I haven't played chess in like 4 years. Like, you're going to do so many things that aren't going to matter. So cut yourself a break. Just cut yourself a break.
Yeah, 100% echo what Annie said. There are so many things from high school that I remember worrying about for nights and nights and stressing myself out, and that do not even matter now to me. So yeah, in terms of that, just have fun. Like I've been in school for like the last 23 years of my life. Like, have fun now is, I guess, my thing. I know high school is hard and there's so many things that you have to keep up with, but have fun now, because I don't have much time for it now.
How would you advise them about balancing fun and the things that need to get done?
Time management, which is effective studying, which is not something that I really figured out how to do until vet school. But it's not that hard to just, well, it was hard for me in high school. But sitting down and just kind of listing out your priorities at that moment, I promise you it will get done. You just got to figure out the best route for it, and it's going to differ from person to person. But if you do the work and you prioritize what you want to do, there'll be a way.
Annie? Balance.
I think I put a lot of stock in what was going to look good on my application, and I actually don't think that was too bad of an idea based on like the amount of aid I was able to get for school. So I would say, find things that you can write down and say, I did this and that's great. Don't shy away from that. But I think, if you're getting to the point where you are so stressed out that you're not sleeping, like if you can recognize, like, maybe I'm not the worst, but I'm no longer okay, reach out. Austin has a lot of great resources in terms of like teachers who care and guidance counselors. And I don't know if there's still a school psychologist, but there should be. Reach out and get help, because if you don't know what the balance is, there are people who have been doing this for a while and they can help you sit down and say, you're not going to need that. You're not going to need that. You don't need to be doing that. You can let that go, and then let it go.
Thank you, ladies. That's great advice from both of you. So, Mr. Jaffes, connections. I keep hearing about connections. Do you guys agree?
100%. Again, been touting networking, and I think that's why this is so great. Yonkler and Jaffes, you guys for putting this together. I would have killed for this when I was in high school, because like I didn't know what I was doing. I didn't know a single veterinarian at all, even in high school. I didn't get a pet until I was like 17. So me wanting to be a vet was really surprising. So if I had heard someone like me come to talk, it would have been really inspiring. So I hope you guys take as much from this and reach out to anyone, even the alumni directory they created. There's something for everyone in there.
Thank you, Claudia. I really appreciate that, and you're just fantastic. Both of you guys, I'm so incredibly proud of both of you. Before we sign off, and I'll let Ms. Amato sign off, but you guys are just the best, and thank you so much.
Thank you, ladies, for coming.
Thank
Take
you
care.
so much for having
Thank
us.
you for having us.